Are you worried about hair loss? Do you fear the sight of a receding hairline in the mirror? If you answered yes to either of these questions, you're not alone. Hair loss, particularly in men, is a common concern that affects a large proportion of the population. It's a topic that can be quite sensitive, but it's also one that needs to be addressed. The reasons behind hair loss can vary widely. Some folks may find themselves losing hair due to genetic factors. It's something that's been part of their family history for generations. This type of hair loss, often called male pattern baldness, is quite common and affects many men as they age. Then there are hormonal changes. These changes can sometimes cause hair to thin or fall out. It's a natural part of life, something that happens as we age, and it's something that many people have to deal with. But it's not just about genetics and hormones. Lifestyle factors can also play a role in hair loss. This can include anything from the food you eat to the amount of stress you're under. For instance, a diet lacking in essential nutrients can lead to weaker hair follicles, while high levels of stress can disrupt the normal hair growth cycle. It's also worth noting that certain medical conditions and treatments can cause hair loss. This includes things like thyroid disease, scalp infections, and even certain medications. So if you're experiencing hair loss and you're not sure why, it's always a good idea to consult with a healthcare professional to rule out any underlying health issues. Understanding the causes of hair loss is the first step towards finding a solution. It's important to remember that hair loss is a common issue, and it's something that many people deal with. And while it can certainly be a challenging issue to face, it's not one that you have to face alone. Hair loss can be a challenging issue to deal with, but don't worry, you are not alone in this fight. Ever wondered why hair loss occurs? Why do some men start losing hair at an early age while others maintain a full head of hair well into their golden years? The science behind hair loss is a fascinating blend of genetics, hormones, and the natural processes of our bodies. Let's delve into the details, shall we? Hair growth isn't just a simple process of growth and fall. It's a cycle that includes phases of growth, rest, and shedding. This cycle is influenced by a host of factors, including our genetic makeup and hormones. Our genes play a significant role in determining the health and growth of our hair. If you have a family history of baldness, you're more likely to experience hair loss at some point. Interestingly, this genetic predisposition can come from either side of the family, not just your paternal line as commonly believed. And then there's DHT. Dihydrotestosterone, or DHT for short, is a hormone that's a byproduct of testosterone. It's a key player in hair loss for men. DHT can bind to receptors in your hair follicles, causing them to shrink, weaken, and ultimately stop producing hair. Now let's talk about the hair growth cycle. It consists of 3 phases: anagen, catagen, and telogen. The anagen phase is the growth phase, where your hair grows around ½ an inch every month. This phase lasts for 2 to 7 years, depending on your genetics. Next up is the catagen phase, a short transitional period where the hair follicle shrinks and detaches from the dermal papilla. Finally, there's the telogen phase, also known as the resting phase. This is when the hair falls out and the follicle rests for approximately 3 months before the cycle begins anew. However, when factors like genetics and DHT come into play, this cycle gets disrupted. The growth phase gets shorter, the resting phase extends, and over time, the hair follicles stop producing new hairs, leading to hair loss. Understanding the science behind hair loss is the first step in fighting it. There are countless myths surrounding hair loss. Do hats cause baldness? Does shampooing too often result in hair loss? Let's delve into the truth and debunk these common misconceptions. First up, wearing hats. Many believe that sporting a cap too often can cause your hair to fall out. However, this is not the case. There's no scientific evidence to suggest that hats are a culprit for hair loss. So feel free to don your favorite baseball cap without fear. Moving on to the myth about over-shampooing. The notion that washing your hair too frequently leads to hair loss is also unfounded. Shampoo merely cleans the scalp and removes surface oils. It can't penetrate the scalp or affect the hair follicles where hair growth begins. So, lather, rinse, and repeat as often as you like. Remember, hair loss is typically down to genetics, age, or health conditions, not your hat or shampoo habits. Armed with the right information, you are now ready to tackle hair loss head-on. Now let's delve into the world of hair loss treatments. What works, what doesn't, and what's worth trying. Our journey into the realm of hair loss solutions reveals a wide spectrum of options, from over-the-counter products and prescription medications to surgical interventions. Let's kick off with over-the-counter products, which are the most accessible and widely used. Minoxidil, you might know it as Rogaine, is one such product. It's a topical solution that you apply directly to your scalp. It works by stimulating hair follicles, promoting hair growth, and slowing down hair loss. But keep in mind, patience is key here. It may take several months to notice any changes, and you'll need to keep using it to maintain the results. Next up, we have prescription medications, and finasteride or Propecia is the leading player here. This is a pill that you take daily. It works by blocking the production of a hormone that leads to hair loss in men. Clinical trials have shown it to be effective in slowing down hair loss and in some cases promoting new growth. But remember, it's not without potential side effects, so it's crucial to discuss this with your healthcare provider. Then there's the surgical route. Hair transplant surgeries, like follicular unit transplantation and follicular unit extraction, involve moving hair follicles from one part of your scalp to another. This can be a more permanent solution, but it's also the most invasive and costly. It's essential to weigh the pros and cons and consult with a reputable specialist before going down this path. Another interesting avenue is low-level laser therapy. It's a non-invasive treatment that uses light energy to stimulate hair growth. It's showing promise, but more research is needed to fully understand its efficacy. In the end, the effectiveness of these treatments can vary greatly from person to person. It's not a one-size-fits-all situation. It's about finding the right fit for you, your lifestyle, and your hair loss pattern. Remember, not every treatment will work for everyone. It's important to find what works for you. So what are the best hair loss treatments according to science? Let's cut to the chase. When we talk about hair loss treatments backed by science, we're looking at two key players in this field. The first is a medication known as minoxidil, and the second is finasteride. Minoxidil, commonly known as Rogaine, is a topical treatment that you apply directly to your scalp. It works by stimulating hair follicles to shift from the resting phase to the growth phase. It's a bit like a motivational speaker for your hair follicles, encouraging them to get up and grow. While it doesn't work for everyone, studies show that about 2/3 of men who use it see some hair regrowth. On the other hand, finasteride, also known as Propecia, is an oral medication taken once a day. It works by blocking the production of a hormone called DHT, which is a major contributor to male pattern baldness. Clinical trials have shown that around 80% of men who use finasteride see a halt in hair loss, and some even experience new growth. Now you might be wondering, can I use both? And the answer is yes. Using both minoxidil and finasteride can potentially give you the best shot at halting hair loss and promoting new growth. But remember, while these treatments can be effective, they're not magic. They require consistent use and patience. It can take anywhere from 3 to 6 months to see results. In addition to these treatments, maintaining a healthy lifestyle can also contribute to healthier hair. This includes a balanced diet, regular exercise, and minimizing stress. And lastly, let's not forget about hair transplants. While this is a more invasive and costly option, it is also the most permanent solution. Transplants involve taking hair from a donor area and grafting it onto the balding area. It's a procedure done by a specialist and can offer very natural-looking results. Hair loss might feel like a tough battle, but with the right knowledge and tools, you can take control. Hair loss is a common concern among men, but it's not an insurmountable problem. We've journeyed together through the thick and thin of hair loss today, shedding light on its scientific roots and debunking myths that have long clouded our understanding. We've explored the myriad of treatments available, each with its own merits and potential drawbacks, making it clear that there's no one-size-fits-all solution. We've delved into the science-backed treatments that have shown promise and effectiveness, offering hope to many. All this knowledge empowers us to approach hair loss with a fresh perspective and confidence. It's not just about finding a solution, but understanding the why and how behind our hair loss. This understanding enables us to make informed decisions about our treatment options and gives us control over our hair loss journey. With the right knowledge and treatment, you can confidently face hair loss. Remember, you're not alone in this journey. If you enjoyed this video, please like, comment, and subscribe to the channel. Take care.